All right, thank you so much, ladies and gentlemen, for watching Imani Television and for following our programs. We have a lot of programs that educate you and also give you spiritual awakening. Today, this is health, hygiene and wellness. My name is Barasa Saenyi and I'm hosting Dr. Silas Wambulwa. Being the 24th March of the year 2023, we are marking the World Tuberculosis Day. So we'll have a discussion here with Dr. Silas Wambulwa from Kitale County Referral Hospital, where he will be demystifying for us about tuberculosis and how it affects us in our societies. Kwa hivyo, let's go straight away to our discussion. Daktari, karibu sana.
Thank you so much.
How are you this morning?
I'm good. I'm glad I'm alive.
Yes.
Thank God.
Yeah.
Now
let's talk about TB.
Yes.
Tuberculosis. What is TB? Is it just a normal flu, or there is something more about TB?
First of all, thank you for giving me a chance to speak to wananchi about diseases every time I've been here.
Yes.
And it's always good because we are encouraging our people to come to the hospitals.
Yes.
For early diagnosis. That is the main purpose why we do these daily discussions.
Yes.
Okay, focusing on TB, as you've mentioned, on 24th of every March, we mark the World TB Day. When we mean World TB Day, it means everybody in the world is talking about TB today. And you know, TB, we actually deal with TB and leprosy. They are one of the diseases that have been mentioned even in the Bible.
Yes.
Because they were there.
TB is also in the Bible.
Yeah.
Oh, wow.
Even leprosy.
Leprosy, I've heard of it, but TB.
They were there in the old days.
Yes.
Only that the mechanisms of diagnosis were not there. But currently we have enough mechanisms of diagnosis. We have molecular ways of diagnosing TB, and which we will discuss today. And it's just the people to come to the hospital because we are moving towards ending TB. The world has not ended TB, but some countries have stretched to an extent that they are having very minimal cases of TB infections. So even as we can be able to end TB infections, just the way we did for corona, and actually currently the number of corona infections are low, then we can also do something for TB. So TB, tuberculosis, is actually not viral. It's a bacterial infection. It is caused by a bacteria, and it is a very infectious disease, and I will explain how it comes. Mostly it affects people who have a lowered immune system, maybe a reduced immune system by different reasons. Your immune system goes down, so you might easily get TB infection. And it's just an exposure to somebody who has TB that gives you TB. So that is what we call tuberculosis. So an infection mostly affects the lungs, but as you've heard from several other people, TB affects any part of your body, not necessarily the lungs. The only part that cannot be affected by TB is your hair and maybe your nails. But even your nose, your tongue, your spine, your bones can be affected by TB. So TB is that serious that it affects every organ in your body. Yeah.
Now, Doctor is speaking about TB being spread all over the world and maybe in different countries. How can we rate TB in our country, Kenya, right now?
Many steps have been made towards the control of TB. But the challenges that we are having currently is the infections of HIV that are going up, and more specifically in the young people who are still very vibrant. They are moving around. So you find a young man who has had HIV infection for the last 3 years. This young man has infected many people. These many people have their lowered immune system. They already have TB. They are again infecting other people. So by the time we realize this string of people who have HIV,
it's a lot.
And already they have TB, they come to us with symptoms, it is too late. They have already spread to other people. You see? So the challenge that we are facing as in the war against TB as a country is the new infections that our country is experiencing for HIV in the young people. And young people, I mean those who are below 30 years. They are the most infected with HIV. And the reasons you know why. Children are so much exposed nowadays.
And vibrant at the same time.
So they are getting HIV.
Yes.
So they are having sex without protection, then they are getting HIV. When they get HIV, it is the number one risk for TB. So the country had pulled the strings for TB. They were down. But currently, we almost up again, but we are fighting off.
And what can we say is the difference between TB infection and TB disease?
Okay, TB infection, maybe it's a good question you have asked. First of all, when you are young, there is an injection you used to get. There is a scar.
BCG.
BCG.
Yes.
There is always a scar on our hands.
Yes.
I wish I had a short...
either on the left or on the right.
Short-sleeved shirt. So it is mostly a protection against TB. We call it BCG. Some people have not taken their children for the BCG vaccine, which is very important. It prevents your body from getting TB. Why? Every time somebody coughs, they might be having a 50% chance they have TB. You understand?
Yes.
So anybody who is coughing ahead of you, you don't know. They might be having TB. The moment they cough, you are infected with TB. So everybody gets infected with TB. That one you should know. Just like any other flu, anybody gets infected with TB. But because of that vaccine that you got when you are young, the body responds very fast and deals with that TB infection. So people who are coughing, it might be a normal flu, it might be TB. So anytime you have had somebody coughing in front of you, they have infected you with TB. Either you knew it or you didn't know it. So when they infect you with TB, that is the moment when you get TB and the body fights. But now, for people who get TB, most of the time, there is something that remains in the lungs. And that infection goes into latency. It's like it doesn't infect you immediately. So the moment your immune system goes down, this disease, this bacteria comes out of latency and it causes the TB disease now. You understand?
Yes.
So you get infected first, then you get the disease. So the disease is what gives you symptoms. You start losing weight and other things that we'll talk about today. Yeah.
So at the latent stage, it is what we call the LTBI, a latent TB infection.
Yeah, actually it is actually latent TB infection. It's just there, but it's not giving you symptoms. Yeah.
That was one of my questions. I wanted to find out, and now I know. Yeah. Now, does it spread only by coughing, or there is another way it spreads?
Not really. TB spreads by coughing. Sometimes we have some materials we handle in the hospital for the healthcare workers. Like blood, even not really blood, but the sputum itself. Sometimes the fluid, we usually withdraw some fluid from the patients, like the cerebrospinal fluid. Yeah, when we are doing tests. And if you don't use protection, you might get infected of TB. So recently we also realized that we can also test TB from urine. And I am not sure if urine can really infect you with TB. Somebody who has urine, we are still doing some research. But I don't know if you can get TB if you get exposed to urine from somebody who has TB. So that's a discussion of another day. But the main cause of infection is coughing.
Coughing. And that is how it spreads.
Yeah, even you see me today, I have a mask because I am coughing. I don't know if it is TB.
Yeah.
So that's why I had to protect.
And I thank you so much, because that is one way of keeping me also safe.
Yeah, because one way, if you are coughing,
yes,
we are lucky. I can say it was a blessing in disguise for having COVID, because you know most people used to see some of us doctors in the hospital with masks before COVID, and they used to wonder, is my disease so serious that the doctor has to put on a mask?
Actually, I was one of them, and I used to assume that maybe it's part of your clothing and safety gears, but I used to think...
Yeah, no. There are some diseases that have been there even before COVID, like TB, which can be protected by using a mask.
Yeah.
That's why when somebody is identified that they have TB, in the old days before we had COVID, the best way of protecting your people, we could give you a mask, you go with it at home, so that when you are coughing, you protect yourself. At times we used to tell them to cover their mouth when they cough, but nowadays everybody knows about the mask.
The mask,
Why
yes.
should you cover your mouth again when you go and greet somebody? You already have those mycobacteriums, and you can easily infect somebody with TB.
Yes.
So the best way, if you have TB at home, just put on a mask. Very simple.
All right.
Yeah.
Now, Dr. Who is at risk of being infected with TB?
Yes, a good question. Everybody, including me and you, because we walk in matatus, we go to public places that are overcrowded. If somebody coughs in an overcrowded place, be sure everybody there has ingested. Maybe, I don't know if that is the right word. They have ingested the TB. So it is what will matter if it will come out to be a disease, it will be your immune system. And if you got the vaccine. And not necessarily that if you got the vaccine, you are not supposed to get TB. You should understand that. Just like COVID, people got the vaccine but they are still getting COVID.
Yes.
Because now, only that the virulence or maybe the severity of the disease for somebody who has the vaccine comes down. So if you have the vaccine, the disease won't be severe on you. You won't even get the full-blown TB. So everybody can get TB. But now, the determinants of the disease, you having the disease, is your immune system. If your immune system is low, definitely you might get TB. Yeah.
Let's talk about the signs and symptoms for TB.
Okay, the signs and symptoms for TB.
Number one, I know it's coughing itself.
Yeah, it's coughing, but sometimes people don't cough. I mentioned earlier that TB can affect everywhere, every part of your body.
Yes, yes.
We have what we call pulmonary TB and extrapulmonary TB. Now, I want to explain the difference. Pulmonary TB is the most common, and pulmonary TB is the most common because everybody who opens their mouth or breathes in, they'll always breathe the bacteria into the lungs. So when you breathe the bacteria into the lungs, likely you will get pulmonary TB. But sometimes we have extrapulmonary TB. We can get infected by even touching. Somebody coughed in this room. Maybe the bacteria
are still alive on some certain surface. Yes.
Yeah. Then you come and touch those surfaces, you get the TB. So sometimes you can still get the TB and it goes extrapulmonary. We have had TB spine. We have had TB adenitis where somebody swells. You might have somebody who has a swelling on the neck, a very long-standing swelling. You know, you need to come to the hospital. Don't just assume. Some people in the villages think it's witchcraft. It's not. It could be TB, that when you start on treatment for TB, it just goes off, the swelling on the neck. There are some people who even develop deformities on their back. They have very severe back pains. When you come and test them for TB, you realize it's just TB. If you treat it, it is already gone. There are people who have difficulties in breathing, like they get easy fatigue when they walk. Whenever you are climbing a hilly place or maybe you are walking with other people, you have to remain back and maybe rest for
a while.
Yes. It could be extrapulmonary TB. There is accumulation of fluid around your lungs. We call it pleural effusion. So that pleural effusion, if treated, you get back to your normal function. Yeah. Especially in young people, it is very common for you to get extrapulmonary TB than the pulmonary TB because of the immune system. Yeah.
Now, at the latent stage, does any of these signs or symptoms display?
With latency, that's why we call it latency. It is just latent, you know. You have the infection, but it's waiting for a trigger, and maybe your immune system has to come down. So you won't have symptoms. People who have symptoms, likely they have had TB for more than 2 months, and at times you might miss to have the symptoms and you have TB. I've seen patients who just come to us who have only weight loss. So the symptoms that we have commonly include you said cough,
yes,
weight loss. If you start losing weight, and I said weight loss means You are losing weight without having an intent to lose weight. You know, people celebrate nowadays when they lose weight.
It's true.
But you have to work for it. You know, you can't start losing weight when you have not you have not
worked any effort
to lose
yes.
weight. So your body is just losing weight and you don't realize. So one way of realizing if you are losing weight is by checking. Number two is by maybe checking your clothes if they are not fitting you. The second symptom is night sweats. So people might sweat a lot at night who have TB. So you find that every night you have drenching night sweats. That is common in TB. Then there is also the sputum production. Most of the time it can be blood stained, it can be yellow, it can be foul smelling. Whenever you cough, you remove a substance that's foul smelling, yellow, blood stained, and those are the things that can be risk for TB. Other symptoms include the symptoms for malaria. We call them malaria symptoms. Lethargy, sweating, fever. There is always a fever in TB sometimes. So people might go for treatment for malaria. If you take those drugs for 3 days and there is no improvement for malaria, don't go back for an injection. Go for a TB screening. Because why should you treat malaria for more than 10 days? Malaria is only treated for 3 days and it's over. So if it's not getting over, don't go back and say this doctor does not know how to treat malaria. Just go for a TB test.
Now, Dr. Before we take a short break now, you see, the signs and symptoms for TB correlate with the signs and symptoms for COVID.
Yes.
At this age, how can you differentiate simply and say that this is COVID and maybe this is TB? Or how do you doctors confirm that this is TB?
Yeah, you know, COVID has its cardinal signs. You've traveled to a place that people were infected with COVID. You are in contact with somebody who had COVID. That is one of the things. Yeah. Then COVID is so acute than TB. TB cannot be that acute. TB cannot start today, but COVID can start today. Like you can be exposed today, tomorrow you already have COVID. But for TB, if you take your history from the patient might have been suffering for a few weeks or a few months before they came to hospital. So that's the difference. But again, another difference is just testing, which is free, both for COVID and for TB. Yeah.
All right. Thank you so much, Dr. Silas. We are still on the discussion about TB. Today being the 24th of March, we are marking the World Tuberculosis Day, and we are just creating awareness on how we can prevent ourselves from this disease and also get rid of it. Don't go too far. We are coming back right after the break.